Recognize Senate President Rob Wagner.
Thank you, Mr. President. Colleagues, Senate Bill 1043 comes to you from your Senate Committee on Health Care with a unanimous 5-0 vote. Very little fiscal impact and no revenue impact. And although my name is on the bill, I want to applaud the governor who worked with her authority to get this bill introduced and who has done a great deal of work around fentanyl and opioid overdoses. It was an honor for me to be able to sit in the Healthcare Committee and for Senator Gorsuch and listen to the testimony and be able to vote on this legislation. As we know, drug abuse and overdose rates have skyrocketed over the last few years in Oregon and across the country. According to the National Institute on Drug Abuse, drug overdose deaths have increased 103% in just 6 years. And here in Oregon alone, it's been a 41% increase. This also isn't an urban and rural divide. An article written by OHSU in 2022 shared that Oregon's peer recovery specialists who provide drugs in rural communities previously reported about 5 non-fatal overdose reports per month. They now encounter 40 to 50. And a vast majority of this is tied to the fentanyl epidemic. We know that opioid overdoses can be reversed with naloxone rescue kits. These are also known under the brand name Narcan when they're in the hands of Oregonians who are at high risk of overdose. Senate Bill 1043 ensures that Oregonians are on a path to recovery are safe, even if they have a moment of relapse. The bill requires facilities that have provided addiction treatment for opioid use disorder to provide 2 doses of overdose reversal medication at discharge or release to the community. The facilities include hospitals, sobering and detox facilities, and residential treatment facilities. The requirement does not apply if the patient leaves the facility against medical advice. SB 1043 also requires OHA to facilitate access to these medications for the facilities covered by the bill. Colleagues, this is not a magic cure, but it will save lives. I urge your aye vote on this bill.
Does the carrier wish to close?
Yes, thank you, Mr. President. Just in attempting to answer the question about cost as it relates to the fiscal, my understanding is that nationally there's still some real work that's being done with states to try to figure out how to make naloxone a lot more affordable, if not free, to communities through different providers. And in the legislation, if you look on page 2, section 5, I believe it's line 37, 38, the reason why I believe the fiscal was kept so low is because it's facilitate access. So it's not a requirement on these different providers to require that naloxone is sent. Finally, Mr. President, this Senate chamber has a long history of supporting attempts at working on fentanyl and opioid overdose prevention. Back in 2019, I had the opportunity to chair the Senate Education Committee, and the senator who sat at the desk where Senator Robinson now sits brought legislation, Senate Bill 665. She was at a Ways and Means Committee, so I got to carry the bill on the floor, and it provided for school districts at that time to have access to naloxone in school because they were so worried. And this is well before Measure 110 was even on the ballot. This is something that has been prevalent and on the rise in our communities. It's on the rise across the country, and it's important that we pass this legislation. That legislation passed 55-0, and I think it would send a really strong signal to the communities that are suffering that we pass this bill with a unanimous vote today. Thank you, Mr. President.